Hi, and welcome to another Right Way Wednesday. My name is Sarah O'Brien, and I'm from the Quality Assurance and Compliance team. Today we're going to talk a little bit about CPT coding. This is something that we spent a couple of months on last fall. During Right Way Wednesdays, a lot of our team and some of the clinical staff even reviewed the CPT guides available on Doc Tools and gave us great examples of treatments that we'd likely see under the CPT billing. Support of our CPT coding is really important, so I thought I'd spend just a few minutes going and doing a quick review of the most commonly used codes, ones that we sometimes see inadequate documentation for. And we know that every site and every population is different. So sometimes CPT codes do usually swing more heavily in one area. And when that happens, it's even more important to make sure that we've got the adequate documentation for every single note under those CPT codes. So what's most important really is to make sure that all of the CPT codes are thoroughly supported within the documentation. So let's start off with the obvious. 97110, which is Therex, and 97530, which is TheraAct. Within these codes, we tend to see a lot of other codes documented, and we also tend to see a little bit less supportive documentation within these two codes as well. Interventions under Therex include things like Omnicycle, New Step, and also targeted muscle strengthening exercises. And when I say that, I'm talking about being specific to the muscle and the muscle group when we are documenting strength training. So hamstrings, biceps, quadriceps, things like that. TheraAct usually involves treatments with bending, lifting, carrying, any overhead activities, and documentation should support both of these with the time frame that this patient was trained in, the frequency needed to train, the volume used, intensity, the type of exercise, and even the quality achieved through these interventions. Also, the documentation should be inclusive of what assistance and what cueing and education was provided during that intervention, and then also the outcome of any education or training. One of the main things to remember about these, and really any intervention, is that if the activity that you're supervising can be done independently by the patient without your assistance, or can be supervised by an unskilled patient, or not patient, but unskilled personnel, then that intervention really isn't skilled. So why don't we take a look at some examples of adequate versus inadequate documentation under these two CPT codes. For Therex, a note that we see more often than we'd like to is New Step times 15 minutes. That's it. There's a lot of information missing from that note. Really, it should sound more like instructed patient on New Step at medium resistance using leg-only setting with verbal cues for upright posture and use of adductors to prevent external hip rotation and adduction substitution. Instructed on safety issues with increasing resistance to monitor RPE. Now we can see all of the skilled work that went into that intervention and then also into the documentation that fully supports that CPT code of 97110. For TheraAct, an example of inadequate documentation is PT-assisted patient during bed mobility, supine to sitting at edge of bed, rolling on each side of bed requiring maximum assistance with 100% verbal and tactile cues in order to increase participation in the activity. So what do you think is missing here? Well, let's take a look at a similar note that has adequate documentation. PT instructed patient an efficient rolling technique using upper extremity and lower extremity muscles together to reduce the physical level of assistance needed. Patient required PT to correct hand placement for positioning. Use of strategies decreased need for assistance from maximal to moderate assistance. So we see exactly which education we were providing as well as the outcome of the education with which caused reduced need for assistance. So 97116 is another CPT code that that I find a lot of times has inadequate documentation with it. So this code, which is gait training, it's typically because the skill by the therapist does not get put into that documentation. Either that or the intervention that was actually utilized was not skilled in the first place. By definition, gait training is the assessment, retraining, or modification of manner of walking and instructions. Is used to correct or improve the manner for walking when they've been impaired by neurological, muscular, skeletal abnormalities or trauma. And again, something to remember is that if the intervention can be performed by the patient or without our skill needed or by an unskilled person, it is not a skilled intervention. So repetitive walking to increase distance or endurance without any correction of gait pattern is not a skilled intervention. Really focus should be on training on how to get around obstacles, going up and down steps, on uneven surfaces, and then also focusing on the quality and safety of ambulation. Also, a gait assessment has to be done before gait training. So that could be done on the plan of care, but also on progress notes or daily notes, just as long as it's documented prior to the implementation of gait training. So some documentation we sometimes see for gait training is patient received gait training on level surfaces with instruction to promote upright posture and core stabilization. There's actually quite a bit missing from this document. So listen to this one. PTA educated patient to perform increased bilateral ankle dorsiflexion during initial contact phase of gait in order to improve the patient's ability to perform proper knee extension and heel strike. Following intervention, patient able to ambulate 10 feet with improved pelvic control, posture, and increased stride length. That sounds a lot more skilled, huh? I mean, there's a lot more information about what the therapist in this intervention was actually doing. Well, I could go on and on about CPT codes, unless I think I would lose you if I haven't already. Please check out Doc Tools button on your iPad, or for you RDs and PMs out there, look in the company documents for the CPT guides and resources folder. It has some great resources on CPT coding, and in fact, you'll find that most of the information that I provided today is in there. And as always, reach out with your questions. You can post right here on Facebook, and also to your RDs, program managers, RVPs, and QAC team. We're all here to help you succeed. Thanks so much, and I hope you have a great week.